They laughed before anyone even checked the patient. Careful, don't ask the limping nurse to run trauma. One resident joked as the ambulance doors burst open and a trauma alert echoed through the emergency department. Emily Carter ignored the comment and moved toward Trauma Bay 3 with the measured stride everyone at St. Matthew Regional Hospital had already learned to notice. She favored her left leg, never complained about it, and never asked for help. To most of the staff, that limp was proof she didn't belong in one of the busiest emergency rooms in Virginia. The incoming report crackled over the radio. Male, mid-30s, training accident, possible chest trauma, unstable blood pressure, arrival in less than 2 minutes. Dr. Nathan Reeves immediately began assigning roles. Emily, stay on supplies. Let the trauma team handle assessment. She simply acknowledged the order and wheeled the airway card into position anyway, checking every drawer as she passed. One respiratory therapist exchanged a puzzled glance with another nurse. She always double-checks everything like she's expecting equipment to fail. The patient arrived surrounded by paramedics who transferred him onto the trauma bed while monitors were connected in practiced rhythm. Dr. Reeves focused on the obvious injuries, calling for imaging and laboratory work. Emily watched silently from the foot of the bed. Her eyes never stayed in one place for long. She noted the patient's uneven breathing pattern, the slight discoloration around his fingertips, the way one shoulder remained unusually rigid despite medication already given in the ambulance. None of those signs alone proved anything, but together they suggested something the initial assessment hadn't addressed. She stepped closer. Doctor, I think we should prepare for possible tension pneumothorax if his breathing worsens. Dr. Reeves barely looked up. Vitals don't support that. Stay with your assignment. Emily didn't argue. Instead, she quietly confirmed that the decompression kit was stocked and placed it within immediate reach before returning to the supply station. A younger nurse frowned. You're wasting time. Nobody asked for that. Emily answered only. If we need it later, seconds matter. Less than a minute passed before the cardiac monitor began showing a rapid decline in blood pressure. The patient's oxygen level dropped despite increased support, and his breathing became noticeably more labored. Dr. Reeves paused, reassessing what had changed so quickly. Emily had already moved the decompression tray beside him without interrupting his examination. He glanced down, surprised it was already there, then immediately ordered the emergency procedure after confirming the worsening condition. Within moments, the patient's breathing began stabilizing, and the room shifted from rising tension back toward controlled urgency. Nobody celebrated. Nobody acknowledged why the necessary equipment had appeared exactly where it was needed before anyone requested it. The resident who had mocked Emily avoided looking in her direction. Dr. Reeves simply continued issuing orders, though his expression lingered on her for a second longer than before. Emily stepped back without expecting recognition and began restocking the tray she had opened, preparing it for whoever might need it next. As the patient was transferred for further treatment, the charge nurse informed the team that additional visitors were arriving from the nearby naval installation. Training accidents involving special operations personnel rarely attracted outside attention, but today's case apparently did. Moments later, the automatic doors opened again. Several uniformed Navy personnel entered the emergency department with disciplined urgency, and among them walked a tall commander whose eyes swept across the trauma bay only once before stopping unexpectedly on the quiet nurse with the limp. He didn't speak. He simply stared as if something impossible had just stepped back into his world. The commander remained near the entrance while the rest of the Navy personnel spoke with hospital security and the attending physician, but his attention kept returning to Emily Carter as if he recognized something he could not quite place. Emily did not acknowledge the stare. She finished restocking the decompression tray, replaced every missing item in its proper slot, and verified the expiration dates on emergency medications before closing the cart. A resident watched with visible impatience. You already checked that once. Emily answered without looking up. Someone else may need it before pharmacy has time to refill it. The comment sounded routine, yet the precision of her workflow left the charge nurse wondering why every movement seemed driven by experience instead of habit. Before anyone could ask another question, The overhead speaker announced a second trauma arrival from the same training exercise. Another service member was being transported with possible internal injuries after collapsing during evacuation. The emergency department shifted back into motion. Dr. Nathan Reeves organized the incoming team and assigned Emily to prepare the secondary trauma bay, while another nurse rolled her eyes. Just get the room ready. Leave the assessment to the physicians. Emily nodded and immediately noticed that the blood warmer requested for the first patient had never been returned to storage. She retrieved a backup unit herself instead of waiting for someone to discover the problem after the patient arrived. The ambulance reached the bay less than 2 minutes later. The new patient appeared stable enough to answer questions, and the initial examination suggested dehydration combined with minor orthopedic injuries. While attaching monitoring leads, Emily noticed dried salt stains on the uniform collar, unusually delayed capillary refill, and a slight hesitation every time the patient took a deeper breath. She studied the monitor for another few seconds before speaking. "Doctor, I recommend repeating the chest assessment after the portable imaging is completed. His breathing pattern is changing." Dr. Reeves glanced at the monitor and shook his head. "His oxygen saturation is acceptable. Let us finish the standard workup first." Emily stepped back without arguing, documenting the respiratory rate with unusual care before continuing her assigned tasks. Several minutes later, the portable chest X-ray appeared on the monitor. The radiology technician enlarged the image while Dr. Reeves reviewed it in silence. A subtle abnormality that had not been obvious during the first examination prompted him to order additional evaluation immediately. He did not mention Emily's earlier recommendation, but the resident standing beside him quietly looked toward her, remembering that she had raised the concern before the imaging confirmed it. The atmosphere changed almost imperceptibly. Nobody openly questioned her anymore, yet nobody understood why she continued noticing problems before they became obvious. Even simple routines seemed different around her. She always stood where she could see every monitor in the room. She instinctively positioned equipment so no one had to search for it during an emergency. She never hurried, but she was somehow always one step ahead of what the situation required. The commander observed all of it without interrupting a single medical decision. He exchanged only a few words with the senior physician before walking farther down the hallway. As he passed the nurse's station, his eyes fell on a clipboard where Emily had signed her medication verification using her full name. His expression tightened for only a moment before returning to complete composure. He continued walking without asking a single question, but just before disappearing around the corner, he paused almost instinctively when Emily adjusted her scrub sleeve to wash her hands. For less than a second, something small and faded became visible near her wrist, not a fresh tattoo and not ordinary jewelry, but a weathered marking that made the commander stop mid-step as though an old memory had suddenly resurfaced. The commander remained motionless for another second before continuing down the hallway, but the brief hesitation did not go unnoticed. Emily Carter lowered her sleeve, finished washing her hands, and returned to the trauma bay as though nothing unusual had happened. Behind her, one of the residents leaned toward another nurse. "Did you see that?" He looked at her like he knew her. The charge nurse dismissed the comment and reminded everyone to focus on patient care because both service members still required close observation. Emily checked the medication orders against the electronic chart, then paused at the bedside of the first patient. His blood pressure had improved, but his breathing pattern remained slightly uneven. She studied the monitor, compared it with the previous trend, and quietly reviewed the latest laboratory results before approaching Dr. Nathan Reeves. "His pain level has decreased, but his respiratory effort has not. I think we should reassess before transferring him upstairs." Dr. Reeves looked briefly at the chart. Radiology already cleared the immediate concern. "We cannot keep every patient in trauma indefinitely." Emily accepted the decision without argument and returned to adjusting the monitoring equipment. Instead of insisting she was right, she repositioned the pulse oximeter, verified the blood pressure cuff placement, and documented another complete set of vital signs, so the next comparison would be accurate. Several minutes later, while transport staff prepared to move the patient, The monitor showed a gradual decline in oxygen saturation that had not been present earlier. Because Emily had recorded consistent trend data instead of relying on a single reading, Dr. Reeves immediately recognized that the change was genuine rather than a faulty sensor. He ordered another bedside examination before authorizing transport. The reassessment revealed that the patient's condition required additional observation rather than immediate transfer. Nobody spoke for a moment. The resident who had questioned Emily earlier looked back at her charting and realized she had not guessed. She had simply noticed a pattern before everyone else. The atmosphere inside the trauma bay shifted in subtle ways. Nurses stopped correcting her routine. Residents began watching where she positioned equipment. Even the respiratory therapist quietly admitted that her preparation had prevented unnecessary delays twice in the same afternoon. Emily never reacted to the growing attention. She restocked supplies, updated documentation, and helped prepare the next room exactly as she had since the beginning of her shift. What puzzled everyone was not extraordinary speed or dramatic confidence, but the consistency of her judgment. She anticipated practical problems before they interrupted patient care, and every decision seemed rooted in observation rather than instinct alone. During a brief lull, one of the newer nurses noticed something else. Emily folded every trauma blanket into identical compact squares before placing them back on the warmer, arranged emergency supplies in the exact same sequence every time, and instinctively chose positions inside each room that gave her a clear view of every patient and every exit. "Who teaches that?" the nurse murmured, receiving only a shrug in response. None of it violated hospital procedure, yet none of it resembled the habits of someone who had spent her entire career inside civilian emergency departments. Across the hallway, the Navy commander finished speaking with hospital administration and turned once more toward the trauma unit. This time his attention did not settle on Emily herself, but on the handwriting across a medication log she had completed moments earlier. He studied the signature, then glanced toward her wrist as if trying to connect two incomplete memories. His expression remained controlled, but he quietly asked the nearest corpsman a single question that nobody else could hear. The corpsman looked confused, shook his head, and answered that he had no idea. The commander said nothing further, yet as Emily reached for a fresh pair of gloves, his eyes narrowed ever so slightly, as though one missing piece of an old puzzle had finally begun to emerge. The Navy commander did not ask another question after the corpsman admitted he recognized nothing unusual, yet he remained near the trauma unit instead of returning to the waiting area with the rest of his team. Emily Carter never seemed aware that anyone was watching her. She completed another medication check, helped prepare an examination room for an incoming patient, and automatically shifted a portable ultrasound machine several feet closer to the doorway before continuing with her work. A technician frowned. Nobody ordered that room for imaging. Emily glanced toward the hallway where emergency medical services were rolling in another stretcher. If they redirect the next patient here, there will not be time to move it later. Less than a minute afterward, the charge nurse redirected the incoming patient exactly as Emily had anticipated because the original trauma room was still occupied. The technician stopped in front of the already positioned equipment and stared for a moment without saying anything. It was another small decision that somehow prevented another delay, but nobody could explain why Emily kept seeing the next problem before everyone else did. As the department settled into a steadier rhythm, one of the hospital pharmacists arrived to verify controlled medication counts after the unusually busy afternoon. Emily handed over the emergency medication log she had completed earlier. The pharmacist noticed that every entry included not only the required documentation, but also precise time references that matched the monitor records almost to the second. "You document like someone who expects every minute to be reviewed later," he remarked with mild curiosity. Emily accepted the clipboard back with a polite nod and simply replied, "Accurate records help the next person make better decisions." It was an ordinary answer, yet the pharmacist found himself looking back at the log after she walked away because very few nurses maintained that level of consistency during a crowded trauma shift. Across the hallway, the commander observed the brief exchange without interrupting. His attention drifted once again to Emily's movements rather than her face. She never turned her back fully toward an active trauma room, instinctively kept pathways clear between equipment carts, and paused for a fraction of a second before entering each patient's space, scanning the entire environment before focusing on a single task. None of those habits appeared unusual to civilians, but something about the sequence seemed strangely familiar to him. He folded his arms, studying the pattern instead of the person, as though he had seen the same routine somewhere years before under very different circumstances. The realization remained incomplete, leaving him more unsettled than certain. A few minutes later, while replacing a pair of gloves, Emily reached into the pocket of her scrub top and removed a small waterproof notepad to update a patient reminder before slipping it back inside. The movement was brief, but the edge of the worn notebook became visible for an instant. Faded across the weathered cover was a simple stencil of 6 dark letters, almost erased by years of use. The commander froze where he stood, his eyes fixed on the notebook rather than Emily herself. He did not speak, did not step forward, and offered no explanation. He only stared as if those nearly invisible letters had awakened a memory he had spent years trying to forget. The commander remained fixed on the worn notebook until the overhead speaker interrupted the silence with another emergency alert. An elderly visitor waiting near the registration desk suddenly became pale and lost his balance, prompting nearby staff to rush across the lobby. Dr. Nathan Reeves moved toward the scene, while Emily Carter reached the patient from the opposite direction. Before touching him, she noticed an unopened prescription bottle protruding from his jacket pocket, a medical alert bracelet partially hidden beneath his sleeve, and the shallow rhythm of his breathing. She immediately asked the registration clerk to bring the patient's intake paperwork instead of assuming the episode was simply caused by exhaustion. One resident suggested moving the man directly to an examination room, but Emily stopped the stretcher for a brief moment. Please check his blood glucose before giving anything by mouth. His bracelet indicates diabetes, and his medication schedule may explain what we are seeing. The suggestion was met with hesitation because the patient remained awake and responsive. Nevertheless, Dr. Reeves agreed to the quick test since it required only a few seconds. The glucose reading returned critically low, immediately changing the treatment plan. Instead of following the original assumption, the team corrected the patient's blood sugar under close observation, and within minutes his speech became clearer and his color improved noticeably. Dr. Reeves looked at Emily with a different expression than before. This time he did not merely accept the outcome. He asked, "What made you stop the transfer?" Emily answered without drama. His breathing, the medication bottle, and the bracelet did not fit the first impression. It was safer to verify before treating. The explanation sounded completely reasonable, yet everyone standing nearby realized she had once again reached the correct conclusion through careful observation rather than luck. The jokes about her limp had disappeared entirely. Instead, several younger nurses quietly began copying the sequence she used when approaching new patients, hoping to understand what they had overlooked all afternoon. While the emergency department returned to its normal rhythm, the Navy commander slowly approached the nurse's station. He did not interrupt patient care or ask Emily any questions. Instead, his attention settled briefly on the waterproof notebook she had placed beside the medication log while updating her documentation. The faded stencil on the cover had become slightly more visible beneath the bright fluorescent lights. He studied it for only a second before lowering his eyes, as though confirming a memory he still refused to trust completely. Without drawing attention to himself, he reached into his uniform pocket and removed a small challenge coin worn smooth by years of service. He turned it over in his hand, comparing the engraved insignia to the barely visible stencil on the notebook. His face remained composed, but the certainty in his eyes had replaced confusion. He slipped the coin back into his pocket before anyone else noticed. A nearby Navy corpsman watched the silent exchange with growing curiosity and quietly asked, "Sir, do you know that nurse?" The commander did not answer immediately. His gaze lingered on Emily as she prepared medication for another patient with the same disciplined precision she had shown all day. Finally, he spoke only 5 measured words, barely above a whisper. "I have seen that mark before." The corpsman frowned, waiting for an explanation that never came. The commander simply continued watching Emily. His expression caught somewhere between disbelief and recognition, leaving one question hanging in the air for everyone who had begun noticing the same impossible pattern. If he recognized the mark, where had he seen it? And why had a simple emergency room nurse been carrying it all these years? SUA, the commander's quiet remarks spread farther than he intended because the Navy corpsman standing beside him could not hide his reaction. Although nobody interrupted Emily Carter with questions, several members of the emergency department began looking at her differently. She noticed the change but continued preparing discharge instructions for one patient while helping another family understand the next stage of treatment. Her attention remained on the people in front of her rather than the conversations forming behind her. As she explained the warning signs that should prompt an immediate return to the hospital, the elderly diabetic patient she had helped earlier reached for her hand. "You noticed what everyone else missed," he said with sincere gratitude. Emily smiled politely and answered, "Everyone on this team helped you. I only saw one piece of the picture." Her response drew another thoughtful glance from Dr. Nathan Reeves, who had expected someone repeatedly proven right to seek recognition rather than redirect it toward the entire staff. A few minutes later, one of the injured Navy personnel requested permission to thank the nurses before being transported upstairs. As Emily stepped forward to adjust the intravenous tubing for the trip, the patient instinctively relaxed the moment she explained each step in a steady, reassuring voice. The commander observed the exchange from several feet away. He did not interrupt, but hearing the rhythm and wording of her instructions stirred another distant memory he could not fully place. He reached into his pocket once more, looked briefly at the worn challenge coin, then returned it without saying a word. Across the hallway, the charge nurse quietly asked the hospital pharmacist whether Emily had worked at another major trauma center before joining St. Matthew Regional. The pharmacist checked her employment records through the staff directory. "Nothing unusual," he replied. "Several civilian emergency departments, excellent evaluations, continuing education, and no gaps that stand out." The answer explained her recent career, but not the unusual discipline everyone had witnessed throughout the day. It answered one question while creating another. If her civilian record appeared ordinary, where had those deeply ingrained habits originated? During another equipment check, a respiratory T. The weathered identification tag rested beside Emily Carter's waterproof notebook for only a few seconds before the hospital volunteer reached to organize the recovered belongings. Yet those few seconds were enough. Commander Daniel Brooks stepped forward for the first time since arriving at the emergency department. His eyes moved from the faded stencil on the notebook to the engraved format on the old military tag, then back again. He did not raise his voice or draw attention to himself. Instead, he asked the volunteer if he could briefly examine the identification tag before it was sealed again with the patient's property. After receiving permission, he turned the tag over in his hand and studied the familiar lettering. The format was one used years earlier for specialized medical personnel attached to Navy Special Operations Support teams. It was not classified by itself, but almost nobody outside those circles had ever seen it. The corpsman standing beside him looked at the tag, then at Emily's notebook, and his expression shifted from curiosity to disbelief. Emily noticed the brief exchange only because she needed the property cart moved so another patient could pass through the hallway. She thanked the volunteer, picked up her notebook, and continued preparing discharge paperwork without asking why everyone had suddenly fallen silent. At that moment, another nurse requested assistance repositioning a postoperative patient who had become increasingly uncomfortable during recovery. Emily immediately joined the team, adjusted the patient's pillows, reassessed the intravenous tubing, noticed that the blood pressure cuff had slipped into an inaccurate position, corrected it, and suggested a small change in the patient's body alignment before repeating the measurement. The patient's breathing became noticeably easier within moments, and the updated blood pressure reading reflected a far more stable condition than the previous value. Dr. Nathan Reeves watched the entire sequence from beginning to end. Nothing Emily had done was dramatic. Every step followed accepted nursing practice. What separated her from everyone else was the consistency with which she recognized the smallest details before they created larger problems. The room remained unusually quiet after the patient thanked her. Reeves lowered his chart and looked toward Commander Brooks, who still held the military identification tag. Their eyes met for only an instant before the commander slowly returned the tag to the volunteer. Then, almost as though speaking to himself rather than the room, he looked toward Emily and said in a measured voice, "There cannot be two people who organize equipment that way, document every second that precisely, and still carry that old field marking." Emily stopped writing for the first time all afternoon. She met his eyes without surprise, fear, or excitement. The commander took one respectful step closer, his voice barely above a whisper. Falcon 6. Every conversation inside the nurse's station came to an immediate stop. The corpsman stared at Emily in stunned silence. Dr. Reeves looked from the commander to the nurse, who had quietly outperformed expectations throughout the entire shift, finally realizing that every careful observation, every habit, every prepared piece of equipment, and every calm decision had pointed toward the same truth long before anyone recognized it. Emily did not deny the name, but neither did she embrace the attention. After a brief pause, she simply answered, "That call sign belongs to another chapter of my life." There was no pride in her voice, only quiet acceptance. Commander Brooks straightened instinctively, the respect evident in his posture rather than his words. "It also belongs to the medic who kept my team alive when everything else failed." Nobody in the emergency department laughed about Emily's limp anymore. The younger residents lowered their eyes. The nurses who had questioned her judgment exchanged silent glances, and Dr. Reeves gave a small nod that carried far more weight than an apology. Emily responded exactly as she had all day. She picked up the next patient chart waiting on the counter and said, "Someone in room 12 has been waiting long enough." She walked away with the same measured stride, leaving the commander watching in thoughtful silence. As he slipped the old challenge coin back into his pocket, his gaze settled briefly on Emily's limp, and a quiet sadness crossed his face, as though he alone understood that the story behind that injury had never truly been told. The emergency department resumed its familiar rhythm almost immediately, but the atmosphere had changed in ways that did not require anyone to speak. The resident who had joked about Emily Carter's limp at the beginning of the shift silently walked to the trauma cart she had organized earlier. Instead of rearranging it to his own preference, he studied the careful layout for a moment before leaving every item exactly where she had placed it. A younger nurse who had once questioned why Emily checked every drawer before each trauma arrival now completed the same inspection before preparing the next room. No one announced the change. It simply became the new routine because everyone had witnessed how often those small habits prevented larger problems. Dr. Nathan Reeves approached Emily while she updated another patient's chart. He did not mention the call sign or the conversation with Commander Brooks. Instead, he placed the next incoming trauma assignment in front of her and said, "I would like your assessment as soon as the patient arrives." It was a simple request, yet everyone nearby understood what it meant. Earlier that day, he had asked her only to manage supplies. Now he wanted her observations before making clinical decisions. Emily accepted the chart with a brief nod and continued preparing the room exactly as she always had, treating the request as another responsibility rather than a personal victory. Across the hallway, Commander Daniel Brooks watched without interrupting the workflow. He noticed that nobody laughed when Emily's measured stride slowed her slightly between rooms. One orderly quietly held a door open before she reached it. A resident moved an equipment cart out of her path without being asked. Another nurse had already stocked the replacement supplies Emily normally handled herself. None of those gestures drew attention, yet together they reflected something far more meaningful than words. Respect had replaced assumption, and it had happened naturally because every person in the department had seen the same evidence unfold throughout the afternoon. Later, while escorting the elderly diabetic patient toward discharge, Emily noticed that his daughter looked overwhelmed by the stack of medication instructions she had been given. Emily pulled up a chair, reviewed each prescription one at a time, demonstrated how to recognize the earliest warning signs of low blood sugar, and encouraged the family to write questions directly on the instruction sheet before leaving the hospital. The conversation lasted only a few minutes, but the daughter's anxious expression gradually eased into relief. As they prepared to leave, the elderly man reached into his pocket and attempted to hand Emily a folded note of thanks. She smiled and gently returned it to his hand. "Spend this evening with your family instead," she said. "That is all the thanks I need." The family walked away smiling, leaving several staff members watching the exchange in thoughtful silence. Near the end of the shift, the resident who had mocked her that morning paused beside the supply room while Emily checked expiration dates on emergency medications. Without making a speech or searching for elaborate words, he quietly picked up the remaining supply boxes and began stocking the shelves beside her. They worked together for several minutes without conversation. When they finished, he stepped back and simply said, "I understand now why you never rush." Emily closed the cabinet, looked toward the trauma bays where another ambulance crew had just arrived, and answered with the same quiet humility that had defined her entire day. "Patients remember whether we were ready. They rarely remember how fast we walked." She headed toward the incoming stretcher with the same steady determination, her limp unchanged, her pace unchanged, and her purpose unchanged, while everyone who watched her realized that the greatest measure of experience was not the stories someone told about the past, but the lives they continued to serve in the present. The final ambulance of the evening disappeared through the emergency department doors, and for the first time since sunrise the pace inside St. Matthew Regional Hospital slowed enough for everyone to breathe. Emily Carter completed her last patient notes with the same careful handwriting that had quietly drawn so much attention earlier that day. Around her, the routines of the department had begun to change in ways that no policy manual could require. Before each room was prepared, nurses checked emergency equipment twice instead of once. Residents paused for an extra moment to observe patients before rushing toward conclusions. Supply carts remained organized exactly as Emily had arranged them hours earlier because nobody wanted to disturb a system that had already proven its value. None of those changes came from speeches, meetings, or formal instructions. They came from watching one person practice the same discipline every single time. Dr. Nathan Reeves reviewed the shift reports before placing his signature on the final charts. When he reached Emily's documentation, he noticed once again that every observation, every medication time, and every reassessment fit together with remarkable consistency. Without saying anything, he closed the chart and placed it on top of the completed stack, a small gesture that reflected the trust she had earned through actions rather than reputation. Nearby, the young resident who had once laughed at her limp welcomed a newly arriving nurse assigned to the night shift. Instead of introducing Emily as the quiet nurse with the injured leg, he simply said, "If you ever want to learn how to prepare for a trauma patient before the room becomes chaotic, watch how she works." Emily never heard the comment because she was helping environmental services move a heavy equipment cart back into storage after another long day. Commander Daniel Brooks prepared to leave with the remaining Navy personnel. After confirming that every injured service member had been safely admitted or discharged. As he reached the hospital entrance, he stopped and looked back through the glass toward the emergency department. Emily was replacing a single pair of gloves inside a trauma cart that was already fully stocked. It was a task so ordinary that almost anyone else would have overlooked it. Brooks understood why she did it anyway. Readiness was never about dramatic moments. It was built through hundreds of unnoticed decisions made long before anyone realized they mattered. He reached into his pocket, held the worn challenge coin for a moment, then slipped it back without another word. There was nothing left to confirm and nothing left to explain. The truth had already revealed itself through everything Emily had done rather than everything she had said. As her shift finally ended, Emily picked up her weathered waterproof notebook, tucked it carefully into her bag, and walked toward the employee exit with the same measured stride that had started the day, surrounded by quiet judgment. The limp remained. The call sign remained part of her past. Neither defined the work she chose to do every morning. Before leaving, she noticed that one trauma cart drawer had been left slightly open by the incoming night team. She paused, closed it securely, checked the latch one final time, and continued toward the parking lot without looking back. Inside the emergency department, the next trauma alert sounded, and the night staff moved immediately to the equipment exactly where Emily had left it. No one spoke her old call sign. No one needed to. The legacy she left behind was already waiting in every prepared room, every careful observation, and every life made safer because someone had quietly raised the standard.